Hey guys, Dr. Runion here, Dr. Hill. We are so excited to announce that we've been given the safe order to resume providing the high level comprehensive care to all of our patients and start getting everybody back in for dental services and get the hygiene visits and everything going again. I wanted to spend some time to talk about a lot of the changes that we've made and upgrades that we've made to our procedures and our safety protocols to protect ourselves, all of the staff, and the patient's overall health. So it's really important. We wanted to really talk about the things that we're doing. One of the things we're doing, starting out, is a pretty thorough questionnaire asking you just some history questions about where you've been and everything to make sure everything's safe there. So kind of expect that. We ask that you guys wear a face covering when you come into the office. Just protect yourself, protect everybody else. A lot of people have some pretty cool designs, so it's always cool to see that. We've added a HEPA 13 medical grade air filtration just to protect the air quality, really get things moving throughout the office. Excited about that addition. I think it's going to make a big difference. We are going to document all the staff's temperature beginning of the day and throughout the day. Record that, document that, following the guidelines, and we are going to do that for the patient, for each patient as well. Document that body temperature reading is within a normal range, and also some changes to the waiting facility, making sure everybody's spaced out and keeping the social distancing, the 6 feet apart. But most importantly, we're going to space out the appointments so that we can get you in, get you right back to the operatory, and get going. And Dr. Hill's going to talk a little bit about kind of once you get here and get checked in and back to the operatory, some of the changes that we made back into the clinical area.
Yeah, guys, I just want to reiterate what Dr. Jon just said. I am very excited. We are very excited to get back to finally being seeing you guys. We've missed people. I think you all have. You're going to see some different things when you walk into the office. And it's all going to be about protecting you, protecting us, and making sure that we can do our part to make sure that this doesn't get worse than it already is for everybody. You're going to see hand sanitizing all over the place. Back in the back, you're going to see it in the front, you're going to see it everywhere, okay? We're going to look a lot different, all right? We're going to have a lot more gear on, you could say. We're going to have some face shields on, we're going to have different masks on, you'll probably see us with some hairnets on, some gowns, all different kind of stuff. And again, it's all about protecting you. I think one thing that we're going to have you or everybody do, like Dr. Jon kind of talked about, we're going to do a rinse before we get you in, okay? Once you're down in the chair, so that way we can try to eliminate all the bacteria and eliminate anything to just try to, again, make it all safe for everybody, make sure it's an enjoyable experience and a healthy and safe one. And I think we're going to do a great job of taking care of you, and we just ask that you guys kind of follow suit, make sure that you're kind of following the guidelines that Dr. Jon and I have discussed, and that you're going to kind of have to deal with a little bit as we're all kind of going through this.
Some changes that you're going to see, I think it's all in good interest for everybody. Also, we've always followed the highest level of sterilization, following CDC guidelines, OSHA guidelines, ADA guidelines. They've added a few levels of sanitation, but we've always been at the highest level, so it's not a big deal for us to just go a little bit more. But you will see a little bit of time in between procedures to really go those extra steps to clean the rooms and properly sterilize everything. So unfortunately, appointment availability is going to be tough. I mean, it really is. That's the part that's most difficult for us because, we want to get back at it. We want to get people in, get their treatment taken care of. So appointments are going to be limited, and we're just going to work through it the best that we can and accommodate as best you can. So please just work with us on that and know that we're trying our hardest. We're doing everything we can to properly train staff on the new updates. We had to get educated ourselves, but then to pass that training on the staff, and then obviously give us the time to be able to do that, and then get everybody in safely, get the treatment done, and just keep moving on. So just like everything else, it's a learning thing. It's constantly changing, but we're trying to stay on the forefront of it and do the best that we can. So look forward to seeing you guys. Our website is always a great resource to learn some stuff. Our social media, and of course, call the office, email, anything you need, and we'll be here to take care of you. But like I said, we're ready to get going. So look forward to seeing you guys. Take care.
See you guys.